Well, good morning. Good morning. All right. Let me welcome all of you to National Academy of Medicine. And on behalf of my co-chair, Mark McClellan, Mike McGinnis, who actually has been a great leader as the executive officer of the Academy, helping us guide this project, and importantly, our project leader, Liz Finkelman, who's here. I just want to welcome all of you. Now, this is a national discussion or conversation, not a national debate. That's for tonight. That being said, I think that Mark has made a really important point about where we are in terms of, health and healthcare. We are indeed at a critical inflection point. I think there's unprecedented opportunities, as you heard, from that list of exciting science and technology to big challenges, as you heard in this talk. We think that meaningful change is possible, and we're capable of really creating a healthier and more efficient and equitable nation. I think we all believe in this. And I know everyone in this room loves this country and want to see it that way. The question is how to get there. And we believe that, if you turn on the news every day and the highly polarized discussion, which are political, we believe that evidence-based and also nonpartisan discussion is really, really important. How do you move this conversation forward, and how do we inform the decision makers to make the right decision? So about a year ago, in conversation with many of you and with my council, it became obvious that this is an opportunity for us, the National Academy of Medicine, to lead and to start planning and inform, because we are ready for a new U.S. administration, in fact, very shortly. At the time, we thought this is an opportunity to reach policymakers and leaders if we begin to get the right people together, the very important experts, many of whom are in this room today. So the idea of the vital directions for health and healthcare is to mobilize expert opinions from trusted and leading health and healthcare experts to inform the next U.S. administration and also the nation, the public, and all the stakeholders about what we all believe is still need to be done in this country. What are the priorities in health issues, and what are the most pressing issues? So one of the goal of this is to actually identify those areas of opportunity and begin to explore policies that may be immediately actionable, and of course also long-term possibilities to address the issue of access, cost, and affordability, so that we can accelerate, in fact, progress to a healthy country. So the idea of the vital directions, ultimately, as you see in the material that you have, is to give a set of recommendations from these experts so that whether it's whoever's in charge in the White House or next Congress will have said, yes, the experts objectively, independently have spoken, this is what we should be looking at. Now, why the National Academy? Well, I think many of you know that we have had many years now, in fact, from our roots in Iowa, 46 years of being a trusted independent advisor to the government, and also, of course, globally in health and healthcare. What I think we've been good at is convening the very best experts to come together independently in a neutral fashion, using evidence-based to inform the nation in many different topics that you know of so well. And I just put a little advertisement for ourselves. The New York Times things were pretty good, and I guess that's a badge of honor. So what about this project? I put the 4 C's to this project: conceptualize, commission, conceptualize, convene, commission, and communicate. That's what we try to do. We started thinking about this project, as I said, a good year ago, and then we convened together the experts of a steering committee that help us think about how to guide this project. We commissioned over 150 experts to write 19 different papers that covers, I think, to a large extent, the waterfront of health and healthcare. And then we plan to disseminate, communicate, and implement many of these findings that we're going to hear about that today. So there are 5 phases to this initiative. First is a leadership steering committee of 18 members. Following that, they've commissioned, as I said, 150 experts along 19 different papers. And these papers now are first published a week ago at the NAM site, which is you can access looking at nam.edu/VitalDirections. They contain all the authors and a more detailed discussion of these 19 papers. Just this morning, you heard the JAMA publish all 19 viewpoints, which are shorter versions of the discussion papers, particularly for people like me who have short attention span. You should be able to see quickly what those vital directions are. And then today, we now want to have a conversation and input, hearing from you what's missing, what is strong, and through this debate, that would inform the steering committee how to put them all together in a synthesis paper, which will come out shortly after election. And of course, importantly, we have already started moving, and we will continue to move over 2017 to disseminate, communicate, and hopefully to implement many of these findings with the new U.S. administration. It's important for me to first thank the steering committee. This is an amazing group. My co-chair, Mark McClellan, does not need any introduction. He has already spoken. But he's been a great partner to work with. And of course, as I said, Mike McGuinness, the executive officer. Now, this committee, when we put together, we had in mind health experts. And you can recognize many of the names in there, like Maureen McCoy, Angela Diaz, Ruth Parker, Len Schaefer, Glenn Steele, Pamela Thompson, that cuts across administration to physician to nursing, health professionals. But also we have a unique group of people who are health experts who's been previously in the administration and been policymakers. They're all known to be independent. We can truly say this is not only bipartisan, but nonpartisan. People like Mark, people like Tom Dashiell and Sheila Burke, and of course, Mike Levitt and Alice Suhuni and Bill Frist, Peggy Hamburg, Jane Henney, highly experienced, and their knowledge of how things work was critical in helping us put this forward in convening and commissioning the right papers, etc., and also in planning how to disseminate this. We have patient representative, and you're going to hear from very, very powerful voice from Meg Gaines, but also, from industry. Eli Suhuni, of course, is now at Sanofi, and public health, Shriki Kumayika, and of course, insurance, Lou Sandy. So it's a very thoughtful committee we put together with right balance. And this committee has been extremely helpful and objective in saying, what are those issues that we need to think about? And that leads me to talk about the goals of the initiative. We've identified 3 themes or goals. One, of course, is better health and well-being. You're going to hear a panel discussing this. Second is high-value health care. Mark has made a very important issue, compelling argument for the need for such a thing in order for us to move forward. And of course, driven by science, strong science and technology, which can be enormously impactful in how we move forward in this area. Now, you can't see this, but I will tell you how this is all weaved together. They're just not 19 individual papers. Look at better health and well-being. Start talking about system strategy throughout the entire life course. We all know how important early childhood is, actually from birth all the way end-of-life care, and needing a system approach to this. And also, as Mark pointed out, addressing the social determinant issues, because we recognize that we don't address them. Healthcare is a small piece of influencing health. And therefore, we need to work with so many different factors. And the work we do here, NAM, and incorporate social determinants of health into electronic health records, and look at socially at-risk individuals, and how to actually make sure that we begin to work with many stakeholders to address this. We also look at, of course, throughout the life course, some very specific area of population, such as mental disease, such as the aging population, mental illness, and others, and chronic disease, and what can be done about those. And of course, importantly, is to advance the health of community and population health. So that's the purpose of the health and well-being section. That links very nicely to, of course, as has been talked about, how high-value healthcare. In order to get more efficient, more effective, and more affordable care, we need to have benefit design, but also payment reform to have more high value and for medical innovation. And to shift, in fact, from volume to value, but enabling the providers and others to have those competencies. And of course, importantly, care coordination, integration, the whole area of the potential precision medicine, how that's going to be helpful, and how can we make sure that it's used appropriately and does not increase inequity, but is affordable. Fostering outcomes, safe and quality and cost, but importantly, the democratization of healthcare, and finally, of course, the workforce. What kind of workforce do we need for the future in the delivery of care? So a very thoughtful series of papers. And of course, with the last section to say science and technology is going to really help us transform if we do it well, while maintaining the very close provider-patient relationship, but information technology, data acquisition, curation and use for learning health system, innovation and developing, but also regulatory adaptation, if not reform, with all the technology you heard coming down the pike in human gene editing, immunotherapy, and all the others. And we took one area as brain disorder as an example of how to pull them all together in science and research. And of course, very importantly, and a thoughtful article led by Elias Suhuni and Story Landers is, what about the workforce for the science of the 21st century? So these are not individual papers somewhat randomly. They actually all pulled together with a very good theme. What we need to do is to get input from all of you today through the symposium, the national conversation, to help us to say, first to let you know, and many of you are co-authors, but to those who have not, what really are the policy directions we propose, to get opinion leaders' perspectives. You're going to hear, in fact, from people who are authors and those who are not, to talk about what they think about the vital directions, and then identify outstanding question issues. What have we missed? What do we need to think about? And explore opportunity and themes at this time, and of course, discuss the critical priorities so that you can inform us, we can put them all together for the incoming administration. That, of course, this conversation and your input is going to influence how we put them all together in a synthesis paper that, in fact, the steering committee is going to write. You see today, and I want to really thank the panelists and the moderators for coming all the way to Washington to actually help us discuss some of the issues. And I won't go over the meeting per se, because you're going to hear from many of them. Suffice to say, we have experts and people who are authors of the paper, and also people who are not, who give us kind of their objective opinion. Now, the synthesis is important because at the end of the day, as you see in one of the two editorials of JAMA, they say, oh, that's a lot of things to swallow at the same time. What about these areas? Well, we knew that. We thought this is a step towards getting your input so that we can ultimately put together in the synthesis paper, informed by decision papers, discussion papers, in our conversation today. So where do we want to go from here? Well, I should first point out to you that the National Academy of Medicine conceptualized, convened, and commissioned. These are the opinions of the 150 experts, Many of you who know about our processes know that at NAM or National Academies, if it's a consensus paper through extensive discussion for a year or longer, you know, we would put, say, our name behind, those are our recommendations. This one, we have initiated this, but it does reflect the 150 opinions of individual experts. And these recommendations, therefore, are not formal recommendations from NAM, but in fact, they represent the commission recommendation of the experts. But you consider the 150 people that we carefully put together, you know, in fact, this is the, you know, the feeling, if you will, of the very best of the nation in terms of where we should be going. Clearly, what we want to do is to inform the next administration and policymakers, and we have planned Hill briefings, and together not only with the agencies, the Hill, but also transition teams, and through different mechanisms. But also we want to have the public attention. So this meeting is open to the public. We want the public to tell us, because we're really, in a way, representing what people feel. Also, multi-stakeholder engagement, and importantly, long-term relationship with these stakeholders around collaborative work that builds on the VitalDirections foundation to accelerate progress in the coming years. So I just want to point out, because all of you are thinking, this is a very broad series of activities, and we do have a great team. I want to give particularly shout out to Laura DeStefano, the head of our communications team, working with the communication group of the steering committee, have put forward this idea. There's many of these steps. Our outreach will have, as I said, Hill briefings, federal briefings, meeting with members of Congress, president's transition team. We already reached out to the teams, key members of the U.S. administration, of course, particularly the health team and the agency staff, and ongoing convening activities to continue to push forward, hopefully representing your feeling about where this nation needs to be. So thank you very much indeed for being here today, and I really look forward to a great conversation for the rest of the day. Thank you. So with that, I'd like to ask Sheila Burke to come up and moderate the first panel discussion. Sheila will introduce the panelists. Thank you. Sheila, as you know, is a well-known health policy expert, having worked in the administration previously. She's currently the adjunct lecturer in the public policy at Harvard Kennedy School, the Malcolm Weiner Center for Social Policy. She served as an executive dean of the school from 1996 to 2000. Previously, she'd been chief of staff to former Senate Majority Leader Bob Dzau, a professional staff member of the Senate Committee on Finance, and the deputy staff director of that committee. And from 2000 and 2007, she served as the undersecretary and then deputy secretary of the Smithsonian Institution. So, Sheila, thank you so much for your leadership, and I turn this over to you.